a community that is really tuned in to therapeutic techniques to facilitate the body, brain, etc. So everyone here is just really tuned in to how much work it does take to get to the next level.
It definitely takes work. That's so sweetie. Thank you for sharing all that. It's a pleasure to be here. I love just sharing my mission and empowering, especially clinicians, with tools so that we can spot unnecessary struggling and put the right plans and treatment protocols in place to unlock so much of our potential through vision. And I'm of course biased, but vision's our dominant sensory system, and it should be what's guiding and leading. And as we'll learn shortly, I mean, it's interfering for so many people because of the digital world that we live in now.
Absolutely. And so I want to, a formal introduction. Dr. Bryce Appelbaum is a neuro-optometrist, board certified in vision therapy and rehabilitation. And as you will see and already have seen, is passionate about unlocking life's potential through vision. And I'm just really happy you're here. And I know actually we have several people who wrote to me and said, is it okay if I have someone else come in? Their child is struggling with these issues. And I said, absolutely, bring them. So thank you for being here and what you do. And I love that you said unlocking life's potential.
Thank you. Yeah, I mean, we're gonna learn about a lot about why that is. I can do this a lot of different ways. I have a PowerPoint just so you're not watching my face the whole time, but we can kind of switch back and forth. And I definitely want to leave a lot of time for questions, because that's where the good stuff comes in, where we can kind of talk off the record or on the record, but more about what the implications this has on life in so many different areas.
Well, I'd like to add, if possible, how I even connected with Dr. Appelbaum is through a podcast. But I have patients that when they're trying to do myofunctional therapy cannot look in a mirror, and their eyes would just bounce all over. And I knew I wasn't getting anything, but I wasn't sure what to do. I didn't want to yell at I'd keep saying, look at the mirror, look at the mirror. But, that goes on deaf ears sometimes. So once I heard his podcast, I thought, okay, we need to bring him into our group. He's the guy.
It's nice to see your face.
Yeah,
I absolutely. Pat, it's nice to see your face.
Nice to see you too,
and just to piggyback on that, I mean, those patients, when you say look in the mirror, they don't know where in space they're located, and they don't know where in the mirror that virtual image is. And so it's hard to keep your visual attention on the target. How can you keep your overall attention on that target? So that can be really challenging.
Yes. Many kids are on the spectrum of some sort. Some are not, but many are. And so it was just really hard for me to say, okay, we're trying to do neuromuscular re-education, but the eyes aren't working. So, and the parents look at me like I have two heads, and I go, and I have sent them for vision testing, and I've had kids come back with glasses, but I just felt there's more to this.
Absolutely. I'm gonna talk about a lot of stuff quickly but clearly, and then we'll have time to talk. Can you guys see my screen here?
Looks good.
Mm-hmm.
Awesome. Do you see any of the other a million windows on my screen or no?
No,
hopefully not. It's great how technology works like that, right? All right, so a couple just kind of want to set the stage a little bit for what we're doing here. So like you both shared, I am on a mission to completely change the way that the world views vision. And that starts today for everybody here, and that starts for all of the clients and patients and family members that you have and work with, where you're going to start looking at things very differently. At least if I'm doing a decent job today, I think I'll do better than a decent job. And so also I want you to know a little bit of my story, so you know where I'm coming from, so that you recognize I'm not making this stuff up. And like you guys shared, I'm a neuro-optometrist. I'm board certified in vision therapy and rehabilitation. I'll share what that means. I've been in private practice for a decade and a half, but truthfully, I've kind of been in this space for about 35 years. And I'll explain the math there, because I'm not that old. But you're going to leave here today with some nuggets, and not these types of nuggets, because it's virtual and we can't pass around dipping sauces or anything, but really nuggets that are going to directly improve your visual systems and give you some actionable take homes. Nuggets are going to help set up a plan of attack for screens, which, you know, we're all engaging right now on the new pandemic, which is screen time, and really also challenge kind of everything that it is you know about vision. But also hopefully there's a little bit of fun with this too. So I want to start by kind of taking a poll here so everybody can see where the raise your hand button is. So I want to just ask a few questions here, and if this applies to you, please click the raise the hand button. So who in this Zoom room gets motion sick? Raise your hand if that's the case. And raise your hand if anyone in here avoids reading. Oh, we already got a lot of hands up. Who in here uses reading as a sleeping pill and you want to go to bed at night and you're like, oh, let me pull out a book so I can just fall asleep faster? The hands are freaking out here. Who in here had trouble or has trouble catching a ball? Who here's eyes get tired and blurry vision and just eye strain from staring at screens for too long? Who in here was told or think they have a lazy eye? Who sometimes avoids eye contact with people because you don't know where to look, or when you are talking to somebody, you're thinking, do I look at their left eye or their right eye or their nose or their mouth, or where am I supposed to look on this face here? Who in here had tears with homework growing up, or tears now when the charts are piling up at the end of the day and you just want to go home and see your family, but you got to finish everything from your day? Who loves being read to but hates to read on their own or avoids reading on their own? And as we can see, there are a ton of hands up. This is kind of nuts. And this is also, you know, you're probably asking yourselves, like, what do all of these symptoms or behaviors have in common? And really, I'll tell you, they all have a visual component that is either the cause or at least an underlying contributing cause of the problem, all of which are entirely treatable through retraining the brain. And I share that I change lives for a living, and so many in this room here also change lives for a living. And for the vast majority of the patients that I work with, my work is the missing piece that they really had no clue they ever needed. Vision problems are everywhere, but they're hidden until you know what to look for, and then they're no longer hidden; they're right in front of your face. So after today, you're going to know what to look for to help prevent so much unnecessary struggling because of these hidden functional vision problems. So many people here have glasses, so you've been to eye doctors. Healthcare really has it all wrong about the eyes. Most doctors, including myself, are trained to look for eyesight and eye health and really have this kind of heavy pursuit of 2020. But eyesight and vision are completely separate entities. So this is kind of the big take home from today. Think of eyesight and vision as separate things. Eyesight refers to how well we can see, whether that's letters on a chart, street signs, for a child what the teacher writes on the board in the classroom. That's a symptom. Vision is far more complex. Vision is how our eyes move together and converge and track and focus and process information, and really how we drive meaning from the world around us and then direct the appropriate action. So eyesight is glasses or contacts. Vision is brain, and vision problems are brain problems. And I'm really here today to share that there is a fix for brain problems through something called vision therapy, which really is a treatment designed to rewire the software of the brain to change how somebody takes in the world around them and then processes visual information. So speaking of processing visual information, what do we see here? Type into the chat if anybody sees something or knows what they see. And sometimes it helps to kind of walk back a little bit from your and pull back from your computer, or lean in a little for some people and go really close. Try to provide yourself a different perspective. And I don't see the chat, but for those who see or can't see or have seen this before, who sees the cow? And you can raise your hands if you raised them before too, but you can also leave them on.
I do not see it. Oh, now
okay, some people.
Okay.
So let me give you a little tip. There's the cow, right? And so now with this outline here, you kind of can't not see the cow, right? So we have functional MRIs that can isolate the areas of our brain that are responsible for these aha moments. that show us when these visual centers of the brain communicate with the processing centers and the proprioceptive centers and all the different connections to highlight the connections that are being made. And this ability to really change your perspective in terms of how you're looking at this picture, rather than black and white contrast to this cow. You're altering how you're taking in the world. And how we all take in the world comes through development of vision and from learning from our life experiences. We're not born with these functional visual skills, and rather we learn how to use our eyes together. We learn how to see the world from different perspectives. So we learn how to shift and see kind of the whole forest, not just the individual tree. We learn how to see the background along with the figure. And these skills are acquired through human development. So, and they can be taught, they can be trained, they can be enhanced, and they can even be reestablished if there's loss from some sort of acquired brain injury. So if you think about how we can influence how someone sees, if we can alter how someone processes visual information, we can really change visual behavior and ultimately change overall behavior, which is pretty profound if you think about how far that can extend to so many aspects of life. So here's a picture of me when I was a young man. And I just want to share my story just so you can kind of get a little bit more perspective of my why. So this is from when I was in first grade, and this was on the soccer field on a fall afternoon at Carteret Springs Elementary School. And my team was playing the Purple People Eaters. I can remember this moment as if it was yesterday, where I'm this kind of lone defender. There's these three attackers on a breakaway coming right at me, and it's just them, me, and the goal behind me. And I just completely froze as if my legs were stuck in quicksand, and these guys just blew past me and easily scored. And I remember feeling completely lost in space, afraid, helpless, really like I let my teammates down and essentially gave away the goal to the other team. And so at the time, I had these visual developmental delays. So what that meant was I had trouble focusing my eyes. I had poorly developed depth perception, and my eyes didn't work well together as a team, really causing me to freeze in moments like this where I should have really sprung into action. And so that night at the dinner table with my parents, I had a complete breakdown. All the tears came pouring out. I shared how I didn't know what to do on the field, where to be, and how in the classroom I couldn't see what the teacher was writing on the board, and often had to ask my friends what the teacher was writing, or walk up to the front and pretend to sharpen my pencil with, I remember those old school pencil sharpeners where you're turning it up in the corner. What happened to those? But you know, at the time, I really worked hard in school, but was a reluctant reader, and I would fly through other subjects like math to try and make up for my deficiencies with reading. And because of my vision, I had this really negative confidence that made me feel like a turtle kind of retreating to my shell in so many aspects of life. And fortunately, I was born to the perfect parents. My mom was a occupational therapist who specialized in sensory integration dysfunction. My father was a developmental optometrist. And it wasn't really until this breakdown where they put the pieces together and recognized what was going on. And from that point forward, they put a plan of action together to really help facilitate the necessary vision development for me to be able to soar in life. And so over the next several years, I did consistent vision therapy, occupational therapy every week. And really, because of the consistent nature of the treatment I received, it all came together for me in about fourth grade, when my eyes, my brain, my body finally all started working together as a team, and this confidence emerged. And I became a strong athlete and started to enjoy reading and developed interpersonal communication skills where I knew confidently my sense of self in space, and turned this disability into a strength where I could really rely on vision to gain an advantage in the world. So I continued with treatment over the years, and obviously with time of transition from patient to clinician, where, you know, for decades I've been studying and helping evolve vision therapy in terms of innovations, technological applications, practices, protocols to really get vision therapy to where it is today, which is still far off from where it needs to be. And I'm happy to report we can accomplish in literally months now what was done for me in years, including for those who've been misdiagnosed with ADD, ADHD, dyslexia, other learning differences, those with lazy eyes and eye turns to really avoid the need for surgery, and sometimes, you know, even develop depth perception for the first time to get their life back on track and turn deficits into weaknesses and strengths and superpowers. And even those with concussions or traumatic brain injury, you know, to return to learn, for a student, for an adult to return to work, really to ultimately be able to return to the life that they've lost and that they love because of this acquired injury. And more so now post-COVID than ever, we're helping a ton of students and adults who are just buried with their heads in screens and smartphones and tech-driven devices who are experiencing all these symptoms like eye strain, headaches, blurry vision, even environmentally induced nearsightedness. So if you can tell by now, I'm on a mission. I'm here because I don't want others to have to struggle the way that I did. And now my focus is to constantly kind of refine standards and practices for vision therapy, make it more accessible, but really help innovate and be on the leading edge of new technologies and therapies and practices, and so we can get this accessible, efficient, and really sustainable moving forward. So just like so many of you, I take a proactive approach rather than a reactive approach, which is all of the whole medical system and systemic health is being reactive, but being proactive completely changes the game. And that's kind of our model here with what we do for vision. So I kind of look at myself as a functional medicine doctor for vision. And with vision therapy, really think of it as physical therapy for the brain through the eyes. And so I have a brick and mortar practices in Maryland, right outside DC. We have an office in Annapolis and in Bethesda. And we treat kind of 5 main populations, but I want to touch briefly today on the 3 big ones, 3 areas of life that can be dramatically improved with vision therapy. And I'm checking time. I think we're good still. So vision is our dominant sensory system. And it's estimated that over 80% of what's learned in the classroom comes from the visual processing of information. And sadly, 1 in 10 kids has a vision problem significant enough to impact learning. And data hasn't come out yet recently, but I would say that number is probably 2.5 times that. This is from from 2008. When children haven't developed the visual skills and abilities really necessary to support the demands of the classroom or of reading or of writing or of learning, they experience symptoms like losing their place with reading, or words going into and out of focus and becoming blurry or even double, or difficulty copying off the blackboard in the classroom, and of course, trouble focusing. And so often in the medical world, labels like ADD, ADHD, dyslexia are so quick to be slapped on behaviors, when in fact these are hidden functional vision problems. And really, to make matters worse, this problem has been exacerbated by the fact that all of our children are being exposed to technology and screens earlier than ever before, and often being asked to read in kindergarten and at earlier and earlier ages before they're visually ready. So if you know a child who hates to read, struggles in school, is squirmy with desk work, prefers to be read to rather than reading on their own, chances are they have a vision problem, and one that's probably treatable through vision therapy. So I would love to just give you guys a very quick screening test that you can all do with anybody with a very expensive piece of equipment. Take a pen or pencil, and in 5 minutes, 3 minutes, you're going to learn more than most eye doctors know in terms of how to uncover these challenges. So it's a lot easier to do this on somebody, but because we're all virtual, we'll just do it on ourselves or practice on somebody later. So we're going to screen for first an ocular motor dysfunction, a tracking problem. So take this pencil or pen, you're going to slowly move it side to side, and then in like a circle form, clockwise, counterclockwise. You can do an H. This is 1,000 times more powerful watching somebody else track this, because tactilely holding this gives you a much better understanding of where this is located in space. But it should be smooth, fluid eye movements across midline. We shouldn't see overshooting or undershooting. We shouldn't see the entire head and body moving. By 7 years old, we should be able to dissociate eye from head movements naturally. So anyone over 7 who's doing this, that's at least a big warning sign. And somebody who has an ocular motor dysfunction or tracking problem is going to likely notice losing their place with reading, skipping words, skipping lines, having trouble tracking the ball in not even just far away, but up close. And this is one of the most important visual skills for reading. So many practitioners, coaches, teachers are doing vision work for tracking because these problems are everywhere. This is x-axis. If we then take this to the z-axis, which is in front of us, Take that same pen or pencil, hold it at arm's length, and you want to slowly bring it towards your nose, making sure you're seeing one single clear pen the entire time. And we should be able to converge our eyes all the way up to our nose. If we are unable to converge the eyes, if you notice an eye drifting, or you seem double, or starts to hurt, or it's painful, that's by definition a convergence insufficiency. And the National Institutes of Health, right down the street from me, about 1.5 miles from my Bethesda office, says that 20% of kids have this problem. I think the number is much higher, but that's still a high percentage. And they say if you're diagnosed with a convergence insufficiency, you're significantly more likely to be mislabeled as having a problem with attention. And to really simplify this, if you have difficulty sustaining visual attention, it's going to be that much harder to sustain cognitive attention compared to if that's not in place. Third is a cover test. This gets tricky on ourselves, but I'm going to share all my contact information. You can always reach out, and I'll talk you through this in more detail. But hold that pen at somebody in front of somebody's face around 12 to 16 inches, and you're going to have them look at the pen. You're going to cover one eye, and the pen shouldn't move. You're going to cover the other eye, and the pen shouldn't move. And if you think about a laser beam representing a line of sight, those laser beams should be pointing directly at the pen. So if you're covering one and you're seeing that open eye then refixate, let's say it moves out, that's because it was turned in. If it moves in, it's because it was turned out. If it was up, it was moved down, and vice versa. So there shouldn't be any movement, but that's a unilateral cover test. If we then do an alternating cover test, what that is covering one eye and then going to the other and going back and forth like this. And I would imagine almost everybody here is going to see this moving. If it starts moving more or farther, the longer you're doing this, there's a difficulty holding alignment with time. And so stamina is an issue. If it's moving, if you're going side to side and it seems like it's moving in, that's an exophoria. If it seems like it's moving out, that's an esophoria. Essentially, all the different fancy names are demonstrating a mismatch of space, a perception of the pen being closer in space or farther in space or higher in space and where it's actually located. And so many vision problems are actually mismatches of where we're aiming our eyes to be and where they're actually located. So just in the interest of time, I want to leave those out there, but please follow up and you will see these problems everywhere. I mean, even at the dinner table tonight. And then at least, okay, something's not right here. Let's dig deeper and go a little further in terms of what that means. Second area of life that I want to talk about that can be dramatically influenced by vision is concussion and traumatic brain injury. There are more areas of our brain dedicated to processing vision, not eyesight, than all of the other senses combined. And 2/3 of the neurons entering our brain actually originate from our eyes. So it's kind of impossible to have a head injury and not have vision be involved. It's just a matter of at what level. And when that occurs, suddenly these previously kind of normal activities of life that, like going to the mall or grocery store, they can become completely visually overwhelming because the brain can't filter and process all of the sensory input. And reading and engaging with screens can elicit dizziness, nausea, blurred vision. So with the right type of vision therapy, we can literally rewire the software of the brain, change how somebody's using their vision, and establish order from all of this disorder. And in my opinion, with the right work, motivation, and compliance, which as therapists, you all know that those are the wild cards. You need motivation and compliance. Almost every concussion can return to previous level of function and return to learn and return to life. Third area of life that I want to talk, and this is probably the most important because it's literally impacting every single one of us, and that's vision challenges related to screen time. Can you believe this stat? The average American spends 7 hours and 4 minutes a day looking at a screen. That's average, which means there's plenty of people who spend a lot longer than that looking at a screen. And during the pandemic in particular, many of us found ourselves spending more and more time in front of digital devices. And now, screens are literally everywhere. They've taken over, they're the new normal, taking over learning, shopping, dating, buying clothes, even chatting with your neighbor. You're not walking next door anymore. You're texting them. Do you have any eggs? I mean, it's a different life. And yet for so many of us, this is creating symptoms such as headaches and eye strain and blurry vision and trouble focusing the eyes and light sensitivity and dry eye and even difficulty sleeping. And the list goes on and on with all of this. So if you think back to when most of us were kids, and really as early as the 2000s, all we did was spend time outside. playing ball, riding bikes, playing in the woods, and all we wanted to do was be outdoors until it got dark out or until our parents yelled at us to come in for dinner. But I love this graphic because we fast forward to today, and it's literally the complete opposite, where we're having to, instead of drag our kids inside, we're having to drag them outside to get away from the screens and the technology and social media and are in the basements where they're playing video games and God knows what else down there. So, I mean, it's a complete flip in terms of society. And we really live in this digital world where screens and technology are anywhere you turn. But I think what's important for all of us today is to recognize that screens present very different demands for the eyes and the brain and make them work much harder than when engaged in three-dimensional space. And, you know, there's different challenges reading and engaging with a screen compared to a printed page. So I've listed a bunch here. You know, I think just to highlight a few of these, there's just very different eye movements required on a screen versus print. There's more of them, they're more sporadic, they're less organized, they're less methodically across the page. You're not holding something at arm's length like we were with the pen before, where you can get the tactile feedback of knowing where that is. It's 2D rather than life, which is 3D. And not to mention the high energy blue light and the brightness and the contrast and the glare. And, you know, it seems like blue light's getting all the attention these days. And I've been joking, it's kind of like the new gluten. You know, blue light is not bad for us. Blue light's actually essential for us. And it's essential from natural blue light from the sun to help us regulate our mood, our alertness, our circadian rhythms. We need blue light for life. So it's great to get outside. It's great to get the fresh sunlight first thing in the morning, right at the end of the day to help regulate your circadian rhythms. But blue light that's blasting our eyes and our brains for 7 hours and 4 minutes plus or longer, that's really the problem. And we have these specialized cells in the back of our eye, in the retina, that, you know, their sole job, their sole responsibility is to signal the sleep-wake mechanism that releases melatonin. And when these cells are overly stimulated and when they're firing all the time, that suppresses the release of melatonin and can contribute to headaches, migraines, other symptoms. And we have clear evidence now that shows that circadian rhythm disruption can be a driving force behind metabolic disorders, even cancers. I mean, we got to sleep. Sleep's so important for recovery. Dry eye, you know, the average person blinks 15 times a minute. And when we're looking at screens, that goes down to 3 to 5 times a minute. That literally causes the tears to be released at a different consistency than what's normal. And you're blinking less, so you're getting fresh tears over the front surface less, and the windshield's getting dirty more. And then the brain sends the signal, we need more tears. So it secretes more, but it secretes more of the watery layer, the aqueous layer, and less of the mucin layer, the outer layer, which can be protective. And so that then signals more and more release, which causes inflammation. And then so much of dry eye is related to screens and the inflammatory response. And now we even have ICD-10 diagnoses for computer vision syndrome, dry eye syndrome that really weren't around not too long ago. And then out of these, I think the last one, myopia or nearsightedness, I mean, we have to talk about this because it is increasing at a crazy alarming rate, especially for countries that value technology and education. So when we landed on the moon, about a fourth of Americans were nearsighted. Now it's about 43, 44% of Americans. And it's estimated that by 2050, 50% of the world will be nearsighted, not just America. I mean, 50% of the world, so that includes countries that don't have technological access like we have now. And the two main risk factors for this, genetics, we can't control who the parents are, but we do know that when both parents are nearsighted, there's a 1 in 2 chance their child will be. When one parent is, there's 1 in 3 chance. And when neither parent is, there's a 1 in 4 chance because of the second risk factor, which is lifestyle or environment. And the prolonged near visual stress, poor lighting levels, and insufficient time outdoors, and then screen time are the main risk factors for speeding up this progression. And we actually have data now to support this. So glasses prescriptions that are constantly changing. You know, my colleagues are very often addressing the symptom, which is far away is blurry. So here's stronger glasses. And then you adapt to those and you need something stronger to maintain the same clarity, but we're ignoring the problem. And so often the functional problem is our focusing system. Inside muscles of the eyes responsible for clarity don't have the ability to hold stamina. They don't have the flexibility. For being proactive, if we're addressing the problem, then the symptom at least slows down, in many cases stops. But if we're addressing the symptom, then this cycle just increases. And this near problem with a distant symptom, that's really kind of the challenge here. And so most people don't realize this, and I've been getting a lot of, I've been disrupted by saying this, but your glasses prescription should not change every year, especially as an adult, unless there's a functional vision problem. Which for many people, it's like, what? I get new glasses every year, and there's always a little bit of a tweak, and I put them on, and then it doesn't feel right, and then I get used to them. Anytime you put glasses on that don't feel right, they're not right. And the ideal prescription should be the weakest lens possible that gives the most improvement, that's the most balance between each eye, and that improves performance. Otherwise, it's just we're taking measurements. Why do we have to do exactly what the measurements say? So, I think what's important to recognize is, the visual stress associated with what we're doing now, staring at screens, that's creating the problem, that's creating the adaptation. And there's so much that we can do to help support that. Screen pandemic. I love this slide. These are my 3 kids. Screen has been on the incline for decades. That's nothing new. And, I don't want to be the old man on the porch raising my cane saying, we can't live like this, but we need to recognize what we can do to empower ourselves for this. And we now know that for children, the screen time is impacting development socially, emotionally, cognitively, but now visually. And so for myself as a concerned parent, and one that became exponentially more concerned in the early weeks of the pandemic, this was literally March of 2020. And I was shocked to see the negative effects that excessive screen time were having on my kids' visual systems and even their overall well-being. So this was a Sunday afternoon. I don't know where I was, but I came home, I saw this, and I remember thinking, what is going on here? My kids have their heads buried in tablets. My stomach dropped. As a functional eye doctor, we were not a house that supported screen time at such a young age, and yet I don't even know where they got their tablets from. They were locked up, but somehow they found them. But here they were, compulsively engaging with screens for school, for homework, for playtime, for entertainment. My 2-year-old, the first time she ever saw a computer was her preschool play date at the time, which she was looking behind the computer when she saw her teacher on there and was like, what the heck is going on here? And we literally just kept them away from her. So, I think this is when the light bulb went off for me that for my kids, for the entire world, screens aren't going anywhere. So unless this is going to become a bigger problem, unless we do something to counter or slow down these negative influences. And so that was really when this whole new pandemic was unfolding before our eyes. And so at that time, that was the birth of a program we have called ScreenFit, which is really if you're suffering from headaches and tired eyes and lack of energy and neck pain, the tech neck from leaning in too much, or after back-to-back Zoom calls, you just want to shut down the screens, then ScreenFit is an amazing solution out there. It's basically a vision training program to help minimize the damage that screens have on vision. So it's a vision wellness program designed to reduce symptoms, promote healthy visual habits, and really kind of reboot the foundation for extended screen time. And so this helps people change their vision, not just their eyesight, so they can actually have the foundation to thrive in this world. I've got a story I'm gonna skip there just because we don't have enough time here, but I always want to address that more screen time to treat screen time seems very counterintuitive, and that's something that everyone always says, like, well, why are you asking us to do this more when this is the problem? That's why we have designed these lessons as compact and impactful as possible, with short interactive videos and protocols and tutorials where we limit the amount of time you're spending staring at the device. So it's me going through a lesson, and then you put the phone down, and then you do the activity or do the exercise. And there's printable companion resources in here. You can access everything without going back to the screen. It's user-friendly. Each course, there's 30 different lessons in 2 different courses, and you're guided through a new lesson each day that takes 5 to 15 minutes to complete each one. You can do them in the bathroom, at a stoplight, and even just things that we can all do in life. And I want to go over a few of these at the end of this if we have time, just so we can all kind of be more proactive starting today. but you'll really learn how to relieve the stress that technology places on our visual system, empowering all of us with the tools for healthy visual habits and efficient use of the eyes together as a team. This has exceeded all my expectations. I created this to help people who didn't have access to vision therapy, because, you know, to be an expert in the space, you really do have to be board certified. In the DC, Maryland area, there's like 6,000 or 7,000 eye doctors. There's only 7 of us who are board certified. And so 2 of the 7 are within my office. There's not many of us who do this. A lot of people can offer vision therapy or vision exercises. And I always just say it's the level of care is very different depending on what you're doing, who you're working with. I think a good parallel is, you know, if you want to get into really good shape, you go to the gym and you work with a trainer one-on-one, and you have access to strength and weights and cardio and flexibility and stretching, and you kind of have a full body approach. But not everybody has access to the gym. And so ScreenFit is kind of like the home workouts, the body weight stuff, like the sit-ups, the air squats, and the push-ups that can get you moving in the right direction. If you don't do the work, though, it's not going to help. And there's so many people who don't have access to vision therapy. So that's why this was created. We've had as young as 5 go through it and as old as 89 go through it successfully, with 100% of people showing a reduction of symptoms, which is mind-boggling. And what I'm so grateful for is ScreenFit alone has gotten vision therapy a seat at the medical table. And we now have companies offering this for corporate wellness. Marriott's offering it to its employees who are actually up for a government contract. So this is something that at least is guided and at least gets the ball going in the right direction. Many people are going to need more than that, but also for the people who just have kind of minor things, this at least helps. And for many people, this does everything. I would love to go over 3 quick exercises where a version of each of these is in ScreenFit, but just so we all have something to take home, and we can actually send a PDF to, maybe send it to you, Pat, after, and then you can send that out to the group that goes over more of the details of all this. But the first one, near far focus. So if everybody take one hand and cover up one of your eyes, and then with the other hand, you can use that pen or pencil from before, or you can use your finger. And you want to bring your finger or the pen or pencil as close to your eye as you can until it gets a little blurry, and then stop and try and make it clear. And as you're trying to make it clear, think about looking close, turning on your focusing system, kind of looking hard at it. You'll notice that the focusing muscle is behind the pupil. So if you're watching somebody do this, their pupil will get small and constrict. So you want to hold it there for 5 seconds. And then after 5 seconds, you want to look as far out into the distance as you can. Throw your focus out the window across the room and relax your focus and look soft and kind of open up periphery. Go out there for 5 seconds and back at your pen or finger for 5 seconds. And then back out in the distance. So you're basically treating this as like push-ups for the focusing muscles. You want to do the same amount of time right eye as you do with left eye. You'll notice that maybe for one eye, you can hold the target closer, which literally means that with both eyes open, one of your eyes is focusing at a different plane than the other. So there's a little bit of a rivalry or competition over sensory input in place. But you want to equalize, do it enough time with each eye, and you'll notice that at a minimum, up close is going to be a little bit more comfortable. It may be a little straining as you're doing this. But, you know, reaching for the stronger over-the-counter readers every time you have a birthday, that is, respectfully, that's being lazy. You do exercises like this, you can prolong the need for an increase in reading glasses. In some cases, actually reduce it. And that's the inside muscles of the eyes, the accommodative system. That's the focusing system. Eye stretches is another great one. Cover up an eye, and what you can do is look as far up to the ceiling as you can. Hold it for 5 seconds. And don't go too high that you can't hold fixation, but go high enough where you can kind of keep it steady. And as far down on the floor as you can, hold it for 5 seconds. And then we'll go to the left, and then to the right, and then the diagonals. And again, same thing, right eye as left eye. And you're stretching the muscles and you're helping hold fixation at points away from midline. And then the third one here, peripheral pointing. This is one where you want to maybe get a little farther back. You're going to cover up an eye with one hand. Find something across the room, like a light switch, a doorknob, where you're going to keep your eye focused on that the entire time and don't look away from that. And then what you can do is notice something else in the room. So for me, I'm noticing a trash can in the corner. So I'm still looking straight ahead, but I'm pointing to where I think that trash can is. And I'm kind of accessing peripheral vision while I'm holding central focus. And when I think I'm pointing right where it is, then look away from the screen and look to see how accurate you are. If you're right on the money there, awesome. Then that means you got to move farther out to something farther away. If you're not, reposition and then come back to the center, bring your hand down and try it again. And so we're basically painting with our periphery, and we want to do the same thing right eye as left eye as you're doing this. When all brains are under stress, from what that looks like from a visual standpoint is our autonomic nervous system goes into the fight or flight response. And visually, our pupils widen and we get this tunnel vision effect. And so under visual stress, we become more central. And in our brain, we have two visual processing pathways that are wired together. One that responds to central focal input, the other that responds to peripheral ambient input. So in a normal, healthy brain, in the absence of stress from our environment, we can look at what's in front of us, see and take in what's around us without having to change our eye movements to take in the room. And remember, any change in eye movement is a change in attention. So if you can't control your eye movements, you can't control your attention as well as you could if that was not the case. But to be able to integrate central and peripheral processing, that's really the global root cause of so much of what we've talked about today. Motion sickness, people who prefer to drive and don't get motion sick when they drive, but if they're a passenger or in the back seat or on a tablet or on a phone, that's literally disequilibrium between the central and peripheral processing systems. And that's the brain getting the signals from the eye movements that we're static, we're not in movement, but that the vestibular system gets activated, the internal GPS system and the roadmap of life that lets us know which way is up and down and left and right. And so that disconnect between those two is what causes this hypersensitivity. When we're driving, we're actually allowing our brain to override focal input and can plan what's coming, versus when we don't have those cues in the backseat or with a tablet or with a phone, and we don't have the optic flow that we can make sense of. So, I mean, I've been on just a tear of podcasts and media opportunities, just talking like we're doing today and raising awareness. And I would say every single conversation gets brought to the mental health component and why driving on a bridge can be scary, or why we can have a panic attack with changes in elevation, or why we get claustrophobic in certain environments. I mean, this is literally our brain going down a rabbit hole of becoming more focal, more central. And we can learn how to establish self-awareness, self-regulation, control of these systems, where I have countless patients who literally can pull themselves out of a scary moment by actively accessing periphery and opening things up. And so it's a lot easier said than done. It requires a lot of training to get to that point. But, mental health being influenced because of vision problems is showing that you care, that things aren't normal, that you don't have control over what's happening. And I think it is becoming a bigger and bigger problem now. And so, so much of anxiety or not trusting what we're seeing can influence so many aspects of our life here. So I love this picture here because this kind of demonstrates to me that the call to action I want everyone to have here. So I'm sure everyone's listening to this today has at least one person in mind, and maybe it's yourself, but maybe somebody in your family, friends, where you realize vision is a missing piece to their puzzle. And it may be a huge piece to their puzzle, but at least it's a piece. And you're kind of excused before because you didn't really know that help existed. But honestly, thanks to Pat now that you have a responsibility to act. So please do not let your friends, your family, your loved ones, your patients struggle unnecessarily in life because of these hidden, misdiagnosed vision problems. So this is me officially lighting fires under everybody to go spread the word. And I can let everybody know where to find doctors like myself based off of where you are in the country or in the world. We now have a formal program where, and I'm going to put my contact information here so you have it all. So the address there is so exciting. In 2 weeks, we are moving across the street of my current place, but to this just dream scenario where the office finally reflects the quality of care that we provide. Twice the space. We are absolutely setting the trend for what a dream scenario looks like for a vision therapy office. And technology wise, I mean, I'm talking about how tech is bad. Tech is massively important for training. And we have a nice mix of high tech and low tech, but we have augmented reality, virtual reality, eye tracking computers where, especially for a child who maybe compliance isn't as easy as it should be, there's asteroids floating around a different screen, and based off of where they look, the asteroid blows up. But if it doesn't blow up, it means, oh, you're looking in the wrong place. And so we're teaching them how to look in the right place. But then also really low tech stuff like glasses and filters and prism, where we're looking at clowns and bunnies and moving images in different places, and they're having to keep it single as they're moving forwards and backwards and all over the place. But love that our operations expert put that in there, because this is dream scenario. And we see now a ton of people that come in from out of state or out of country for intensive programs, so what we call a vision therapy boot camp, doing up to a dozen sessions in a week. Eval beginning of the week, progress at end of the week, and then we put them on a really robust home program for at least 3 months after, with the actual customized VR program that they work on at home and that we go in on the back end and change each week. So lots of solutions for lots of different people. And there's also lots of good doctors who provide great care around the country, but also, just like with all therapy, you want to really find out who's doing the work, where, what the treatment looks like, who you're working with, how often the doctors are involved. We have a unique model where we have doctors running the therapy because it allows for really good quality control. There's no surprises to any of this. We also see some really complicated stuff, but for most places, there's a doctor overseeing, but then there's therapists. But feel free to always ask me, and I can help vet certain places as well. All right, so we got 12 minutes.
We got some time for questions, which is
Awesome.
fabulous because we have a lot of them. Thank you so much. This is just wonderful. And one of the questions Nikki was asking, what are your thoughts on multifocal or using one eye for near and one eye for far contacts?
Yeah. First of all, I hope that wasn't too fast. I was trying to.
Oh, you did amazing.
I had that smoke coming out of my ears. So,
got it.
Firstly, we have two eyes for a reason. We have depth perception for a reason. Choosing to have life be convenient so you don't need to grab glasses, but say you have one for far and one for near, you're using your brain a different way than it is wired. So I am very anti that, except for very specific circumstances. But, especially for people who develop depth perception for the first time, I mean, it is life altering. There's uncontrollable tears in every scenario of happiness. And we have two eyes for a reason. And our brain is wired to have two eyes, but have them operate as one unit. So if you're choosing to say, I don't want to grab glasses, so it's close here, it's far, it's clearer here with this eye, and it's clear out here with this eye, it's then very blurry in the opposite scenario when that's not in place. And a common maladaptation that occurs, especially for kids who have a binocular vision dysfunction or trouble with the eyes working together as a team, is actually to adapt so that they become monovision. I saw a 16-year-old yesterday, first eye exam, and covered one eye, saw the tiny letters, covered the other eye, and literally couldn't even see the big E. And the mom thought he was faking this, and we did 2 hours of testing to know exactly what's going on, but turns out he was a -250 and a plano. And -250 is literally the lens power needed exactly for 16 inches, which is where reading and tablets take place. So rather than having developed the ability for his eyes to work together as a team, he literally created this setup that we couldn't teach a brain to do if we tried, where his left eye was seeing here perfectly, his right eye was seeing out here perfectly, and he had no idea because he had never checked. And their main reason for coming in is he is an elite athlete, and he's great around the hoop playing basketball, but he can't shoot the three. And by then I was like, man, if you're a good athlete now, it is scary where things could be in the future when you actually have depth and the ability to understand sense of self and space. And one of the really fun things I do, I work with a lot of professional sports teams. I help teams identify who to draft or take as a free agent based off of vision development, cognitive development, how far a gap is. And then when there is a big gap, take this person, send them to us, we'll fix the problem, and you get that much more return on the investment versus somebody who's already solid visually an elevation in performance or a longevity with a career, that's based off of other stuff that not in my wheelhouse. But if you don't look, or if, the whole saying, test, don't guess. If you don't look, you don't know what's there. So hopefully that helped. I would say, especially if you can carry a purse with lots of different glasses, if that's needed, let's get both eyes pointing and acting like they're doing the same thing at every distance, so that your brain can benefit from having two eyes that work as a cohesive team.
Nikki, did you want to ask more?
Yeah. So is that also in regards to like the multifocal? I mean, did the multifocal work better or no?
So multifocal is different. So think of monovision as, I guess technically it is multifocal, but it's eyes in different planes. Multifocal would be for most people in their 40s. Our arms aren't long enough, and then we need glasses to help with that. And all doctors say, "Oh yeah, that's what happens." And there are anatomical changes to the lens of the eye where the muscles controlling them become more rigid and less flexible as we age. But just like any muscle in our body, if we stop using them, we lose voluntary control. So I have patients in their 60s and 70s literally without reading glasses, but they're putting in work every day and they're exercising their system, but they are prolonging those age-related changes. So if we're already if we've already jumped into the deep end of the pool and we are in glasses like that, we can reverse them. But multifocal is typically for arm's length, was another distance compared to a screen length versus far away. I would say a progressive lens is kind of the blend as you come down. Most of my patients are dizzy, nauseous, and absolutely hate progressives, but I typically only see people with problems. So that's different. I would say about 75–80% of the population are pretty happy with progressives, and it's nice where if they're fit well, if it's the right balance prescription, you look down, which is where reading takes place, a speedometer, and so you're looking through a different power than compared to looking up. But I would say in general, like a bifocal with a line is going to give a larger field of view for bottom and a larger field of view for top, compared to this kind of blend as you go down, which is a little more limited. But I think in a perfect world, a separate pair for distance, for screens, for showing, for each kind of activity of daily living allows for the largest field of view, but is kind of annoying. And if we can train our brain and train our eyes, you can actually be more flexible and not really need 1,000 different pairs. But for people who do have demands there, the larger the field of view, the better, and the easier to aim your eyes in that zone. I don't give quick answers. I'm sorry.
No, it's good. It's good.
I just have to get over my vanity. I don't want to wear glasses, right? That's what you're saying. Okay.
Well, and I mean, we can talk about your situation. I mean, in many cases, like 20 happy is way more important than 20/20. You don't have to see HD clear at all times. You want to see to a point where you're comfortable, you're not missing out on life, and it's not creating symptoms.
That's good. I like that. What are your thoughts on these amber glasses and, these kind of, levels of blue light that you're barring?
Yeah. I'm going to try and give a quick answer to that. So vision therapy is not the only solution. We do a lot of prism and tints and filters and digital performance lenses and therapeutic lenses. So there's lots of scenarios where we can rely on glasses to help therapeutically. For people with visual snow syndrome, which is a really common syndrome getting a lot of attention these days, or traumatic brain injury, there's certain tints that can be really, really helpful in terms of decreasing sensory overload from the world. Here's a really common one. I don't know if you can see this. This is called Omega. This is like a purplish. This is great for brain injury. We have one called FL41, which is really good for visual snow. So there's different tints that can help a lot. Light is fantastic at altering space and how we process things. And even red light therapy, photobiomodulation, can be wonderful for activating mitochondria and decreasing inflammation. And so we do something called syntonics, which is light therapy, which is either they're staring at a machine for a certain length of time with a certain protocol with a certain wavelength, or we're giving them glasses like this to bring home. And for a child, it's this is alpha omega is one particular color, put these on and you can go play outside for 20 minutes. As long as it's sunny out, your brain is taking in light in a different way. I can count on more than one hand the amount of children on the autism spectrum who use language for the first time ever while going through syntonics in our office. And that's not always what happens, but it's crazy how we can activate different areas of our brain to become engaged when we are arranging conditions to tap into certain neuronal processing in certain ways. Yeah. There's also another group called, I'm sure a lot of people here have heard about Irlen syndrome and Irlen lenses, which is basically one specific rose-colored light that has been around for decades, that a lot of children who are mislabeled as having dyslexia or have visual processing problems notice better organization of space with that particular tint or filter. I would say it can be really helpful, but you definitely want to look at a wide range and also look at the root cause, not just maybe the symptom there, but that can be really helpful. Okay. And a lot of athletes do much better with certain tints as well to look at polarization and grasp blades differently. Sorry, go ahead.
No, I was going to ask you, no, it's really helpful. You know, you get all of this circadian light that people are trying to, or the rhythm of light and how it's influencing culture with these special lenses in front of the screen, just in everyday use. Do you think it's actually helpful?
It definitely can be. You know, I think with blue light, for instance, blue light glasses that block 100% of blue light have to be amber or orange. If you get blue light glasses on Amazon, something that blocks like 433 nanometers could technically be called a blue light lens, but you want a large range of the high energy light. And so anything that is a clear lens, maximum amount of blockage is going to be 30 to 40%. So we actually have a digital performance lens line coming out shortly, but there's also a company I partner with for ones at night that are literally dark orange lenses. I don't have any with me here that really help if you have to be on screens in the evening so that you can calm down your brain quickly to be able to go to bed.
Barbara's wearing them. She wears them.
Yeah.
Yeah, there she is.
Nice work, Barbara. So those all day long sometimes can be disruptive as well. Okay. So especially like after dinner time when the sun actually goes down, that's usually when I recommend them, but you're looking sharp there, Barbara.
You had mentioned that kindergartners are expected to read, and is that developmentally putting strain on the visual system or only on those systems that are not adequately developed?
Yeah, so that's a complete generalization. There are some kindergartners who are ready. Also yesterday, I saw a 5-year-old who the mom has said she's read over 50 chapter books and is all proud of, you know, how much she's the voracious reader she's become, which has a lot of positive. But this child has significantly reduced eye contact, has a big focusing problem in one eye, and has very limited depth perception. And I would argue, and I said this in a nice way, but basically your kid doesn't get outside. The visual systems that are developed for all of us were put under stress before they're visually ready, and she's found ways to adapt and compensate. And now we have these functional vision problems where, as simple as saying, let's have a balance, let's limit how much reading, the visual system would continue to catch up, versus pounding how much reading and ear work there is. If there's a maladaptation in place, it's only going to get worse unless the stress changes. So for certain kids who are held back, that's actually a good thing. But obviously, if you're being more proactive with the right treatments, we're then empowering the body and the systems to catch up so that they can meet those demands. So there are some kindergartners who can read, but if there's resistance from a child, if they're, you know, rubbing their eyes, if they're tilting, if they're covering an eye, if they're tilting the page, if they're leaning in really close, I mean, those are clear cries for help. Like, I can't handle this right now. And most parents don't know what to look for.
It's so interesting. And, you know, we have a lot of questions, but we have 4 minutes technically. So question about the developing bones of the cranium and the head, and namely the sphenoid bone, because we're really looking at that from a tongue posture, the palatine bones that are laterally and developing forward and laterally from the tongue, and how that affects the sphenoid. What's your perception around those bones and the visual challenges if they are developing on one side versus the other?
Love you bring this up. So I work closely with craniosacral therapists, chiropractors, functional neurologists. I mean, everyone who knows that space better than I do. When there is an imbalance structurally, always function follows. And so, the adaptations that we see with eye turns, like very often a kid who skips over crawling or walking, let's say, and goes right and skips over crawling, goes right to walking before they're visually ready, before they've developed the bilateral integration to support the vision learning that comes, they're more likely to have an eye turn or lazy eye. So similar here, if there's structural misalignment, then it's almost like that child is from a visual standpoint running uphill with a weighted vest on. And very often then they're becoming more dominant on one side or with one eye. I mean, everybody has a dominant eye, but the visual midline can then shift, and then the body midline shifts to try and compensate or counter. And so a kid who is a toe walker, or the opposite, walks more in their heels, or has difficulty taking the training wheels off, or gets really close and doesn't understand personal space. I mean, very often there is structural problems up here that, I think in conjunction with vision, addressing from multiple angles gets to a better place faster.
I think, you're kind of singing our heart song here, because we are just working structurally with form, function, and also the collaborative work you do with occupational therapists and, like you said, craniosacral, chiropractic. I mean, all of these systems are kind of coming into focus around how we are using these neurologic connections bilaterally, et cetera. Quick question about loops. Big topic in the dental world.
Yeah.
What's insight there?
So I have a few different thoughts. Can you give me a 10-second description of what you're saying for loops? So make sure I'm thinking about the right loops.
The glasses worn to bring into focus the perception right here.
Detail in the mouth.
Yes.
Okay, that's what I thought. So they can be very helpful. There's a different, if you're spending a good chunk of your day at a particular distance, having occupational glasses are really, really helpful. But also, again, you want to make it so that you're allowing for flexibility. So if you're looking at teeth for 8 hours, like, make sure at least the 20-20-20 rule. Every 20 minutes, take a break for 20 seconds, look at something 20 feet away and kind of disengage. But with loops, I think there's many different types in terms of like multifocal, single vision as well. I've heard a lot of complaints that it's hard to try them out before you buy them. And so people have lots of different variations there as well. But you can also set up the exam chairs very differently. I have a few dentists who actually go to their office. We work closely with a holistic dentist nearby, where like we've moved around the ergonomics to be more visually appealing, and she doesn't even need the loops anymore. But the patient is in a different position and she's relying on other equipment to help.
Well, thank you again. I wish we could spend a whole day with you, but the ScreenFit I think is so helpful. I definitely want people to encourage people, screening tools or what we need to do. Go to MyVisionFirst.com. I think that you will be able to answer this. And we do have more questions, but we are out of time, and I just cannot say thank you enough. This is so.
We need to have him back, Samantha. We need to have Dr. Appelbaum back.
Happy to come back.
You're gonna move in. Okay.
Check out our real fast on social media, where we're putting a lot out there. We've got a TED Talk about to come out end of the year, so a lot to just get this out. and love having support from clinicians, because can't do this alone. And just the more people on the ground, helping raise awareness. And I want to know how I can help support your specialty and all of you. So please don't be shy reaching out.
Thank you so much. You are just, we are so
My
grateful,
pleasure.
and we will go to these
Thank you.
resources. Everybody, just so you know, you can save the chat with the 3 dots at the top. And, if there's some links in there that you want to make sure you have, those 3 dots on the chat, you can just save it. And again, thank you, Dr. Appelbaum. It's just wonderful to hear your stories and how this is impacting the potential that you're unlocking in life. So thank you again. All right,
Thank you so much. Appreciate being on here.
this is amazing.
Have a great weekend,
Have a
everyone.
fabulous weekend. Thank you, Pat. Thank you
You're
so
welcome.
much.